my name is Zoe. I'm going to be your nurse today. How are you?
I'm good. How are you?
Great. Can you please tell me your full name and date of birth?
Tia Goodwinson, 9/12/01.
This is the correct patient. So today I'm going to be performing a focused assessment on you. This assessment will take about 5 to 8 minutes. If you have any questions, pain, or concerns during the assessment, feel free to stop me. The patient understands the purpose of the exam. Before we begin the exam, can you please empty your bladder and put the gown on that ties in the back?
Yep.
Are you comfortable in regards to warmth and privacy in this room?
Yes.
The patient is prepared for the exam and comfortable in regards to warmth and privacy in the room. So first I'm just going to ask you a few questions. Have you ever had problems with your lungs, breathing, or chronic respiratory illnesses?
No.
Have you been experiencing a cough?
No.
Do you have any shortness of breath or pain when breathing?
No.
And have you smoked or are you a smoker?
No.
The patient does not report any symptoms, but if the patient did report symptoms, I would follow up using Olcard's ice or techniques for special circumstances. So now I'm just going to assess your appearance. Breathe normally for me, please. My patient appears to be relaxed. She is sitting upright. My patient's breathing is unlabored, relaxed, and effortless. There are no accessory muscles being used, no retractions or bulges. Her skin is pink and there are no lesions noted. Now I'm just going to take your pulse for a few seconds. The patient's respiration rate is 15 breaths per minute. Now I'm just going to put this probe on your finger. It's just going to assess your oxygen levels. The patient's oxygen saturation is 99%. Now I'm just going to assess your lips and nails. Nails are pink with nail bed of 160 degrees. Lips and oral mucosa are pink. Now if you could just turn for me, please. I'm just going to look at your back and ribs, so just breathe normally. The ribs have a downward slope of 45 degree angle. The thorax is symmetric. The spine is straight. The scapula are symmetric and the muscles are equal and well developed. Now I'm just going to listen to your breath sounds. So if you could please cross your arms in front of your chest, and when I press the stethoscope down, please just take a deep breath through your mouth. If you have any pain, please just let me know. Thank you. Posterior breath sounds are clear and vesicular bilaterally. There are no adventitious breath sounds such as crackling or wheezing. Now I'm just going to do the same thing to your side, so yep, and just breathe or take deep breaths through your mouth again, please. Lateral breath sounds are clear and vesicular bilaterally. There are no adventitious sounds noted such as crackling or wheezing. If you could please turn to the front again. I'm just going to assess your chest and breathing as I did on your back. The thorax is symmetric. The muscles are equal and well developed. The costal angle is 90 degrees and the AP diameter to ratio is 1:2. I'm now just going to listen to your breath sounds on your front of your chest. If you could just breathe or take deep breaths through your mouth again. If you have any pain or tenderness, let me know. Anterior breath sounds are clear and vesicular bilaterally. Vesicular breath sounds are prominent over lung fields, and there are no adventitious sounds noted. If you could please just turn again. I'm just now going to use the palms of my hands to touch your back. If you have any pain or tenderness, please let me know. Was there any pain or tenderness?
No.
The patient denies pain or tenderness in the posterior thorax, and the patient also denies pain or tenderness in the vertebrae. I'm now just going to have you, if you just turn a little bit more.
Sorry.
You're fine. If you just take a deep breath for me, please. The ribs are symmetric, sturdy, and firm with no pain or tenderness, and there is equal expansion bilaterally of the posterior thorax. Now I'm just going to have you repeat the numbers 1, 2, 3 for me, please, as I touch my palms down.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Thank you. The vibrations are equal bilaterally. Now I'm just going to touch some of the important parts of your chest, such as your neck, clavicle, and ribs. If there's any pain or tenderness, please let me know. Can you just look up a little bit? Thank you. The trachea is midline and slightly movable. The clavicles are symmetric and the surrounding muscles are well developed. The ribs are stable, symmetric, painless, and firm. I'm now just going to have you repeat the numbers 1, 2, 3 for me again as I do it on your front.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
The vibrations are equal bilaterally, or in all areas. Is there anything else you'd like me to know before we finish the assessment?
Nope.
Thank you.